Assalamu alaikum. Today we will start to discuss the anatomy of the gluteal region. First, what are the boundaries of the gluteal region? Gluteal region is bounded superiorly by iliac crest, inferiorly by fold of skin of buttocks. Its contents are the following. First, gluteal muscles. Second, superficial fascia. First, we will start with sensory nerve supply to the skin of the gluteal region. Cutaneous nerve supply to the gluteal region derived from the following nerves. First, posterior rami of the spinal nerve lumbar 1, lumbar 2, lumbar 3, sacral 1, sacral 2, and sacral 3, and these are responsible for supplies the skin over the upper medial quadrant. For the upper lateral quadrant, the nerve supply is coming from iliohypogastric nerve and 12 thoracic nerve or subcostal nerve. From the lower quadrants, the lower lateral quadrant derived its nerve supply from lateral cutaneous nerve of thigh, a branch of lumbar plexus. Lower medial quadrant, its nerve supply coming from posterior cutaneous nerve of thigh, which is a branch of sacral plexus. Lastly, the skin over the coccyx, its nerve supply is coming from lower sacral and coccygeal nerves. The lymphatic drainage of the gluteal region drained to the lateral group of superficial inguinal lymph node. You can see in this figure cutaneous nerve supply to the gluteal region, and you can easily see that the area have been divided into quadrants: upper quadrants, lower quadrants, and the upper quadrant, medial quadrant, and lateral quadrant. The lower quadrants are divided into medial quadrant and lateral quadrants. Fascia of the gluteal region. First, superficial fascia. Thick, especially in women. It is impregnated with large quantity of fat, and this contribute for the shape of the buttock area. Second, the fascia. It is continuous below with the fascia latae or the fascia of thigh, and in the gluteal region the fascia splits and includes the gluteus maximus muscle. Above the gluteus maximus muscle, it will be continue as a single layer of the fascia which covers the outer surface of the medius muscle, and finally it is attached to the iliac crest. On the lateral surface of the thigh, the fascia will thicken, become strong, wide band called iliotibial tract. You can see here, this is the deep fascia of the gluteal region, thick, enclose gluteus maximus muscle, covers medius muscle attached above to the iliac crest. On its lateral side is thick band called iliotibial tract, and below deep fascia of the gluteal region is continuous with the deep fascia of thigh, which is called fascia latae. The iliotibial tract, it is thick deep fascia attached above to the tubercle of the iliac crest. Below it is attached to the lateral condyle of the tibia. The iliotibial tract forms a sheath for a muscle called tensor fasciae latae. It receives the greater part of insertion of gluteus maximus muscle also. What are the ligaments that are present in the gluteal region? Two important ligaments present in the gluteal region. One is called sacrotuberous ligament, the other is called sacrospinous ligaments. Their main function is stabilization of the sacrum, prevent the rotation by the weight of the vertebral column. First ligament, sacrotuberous ligament, attached to the back of sacrum to the ischial tuberosity, whereas the sacrospinous ligament, it attaches the back of sacrum to the ischial spine. You can see these two important ligaments. This is the sacrotuberous ligament, and this is sacrospinous ligaments. From the posterior view to the hip region, you can see this is the sacrotuberous ligament, and this is the sacrospinous ligament. In this figure, you can see that these two ligaments, they will convert the greater and lesser sciatic notch into foramina. One is called greater sciatic foramen, the other is called lesser sciatic foramen. So foramina of the gluteal region, greater sciatic foramen, which is formed by greater sciatic notch of the hip bone and the sacrotuberous sacrospinous ligament, and its main function provide an exit from the pelvis to the gluteal region. Structure that passes through greater sciatic foramen are the following structure. First, muscle, piriformis muscle. Second, nerve, sciatic nerve. Third, posterior cutaneous nerve of thigh. Fourth, nerves, superior and inferior gluteal nerves. Fifth, nerve to obturator, internus, and quadratus femoris muscle. Sixth, pudendal nerve. Seventh, arteries. These are the superior and inferior gluteal arteries. Eighth, internal pudendal artery and vein. What about the lesser sciatic foramen? This foramen is formed by lesser sciatic notch of the hip bone and sacrotuberous and sacrospinous ligament. The following structure passes through it. First, muscle, tendon of obturator internus muscle. Second, nerve to the obturator internus. Third, pudendal nerve. Fourth, internal pudendal artery and vein. What are the muscles of the gluteal regions? Muscles of the gluteal region are divided into two groups. deep groove or small muscles. They are mainly lateral rotator of the femur at the hip joint, and they include the following muscles: piriformis muscle, obturator internus muscle, gemellus superior, gemellus inferior, and quadratus femoris muscle. Second group called superficial group or large muscle group. They are mainly abduct and extend hip and include the following muscle: first, gluteus minimus; second, gluteus medius; third, gluteus maximus. An additional muscle to this group is an important muscle called tensor fasciae lata, which is the fourth muscle of this group. What are the nerves of the gluteal region? Sciatic nerve. This is a branch of sacral plexus. It's originated from L4 and 5, S1, 2, and 3 spinal nerves. It emerged from the pelvis through the lower part of the greater sciatic foramen, and the nerve appears below the piriformis muscle and curves downwards and laterally, lying on the root of the ischial spine. Superior gemellus, obturator internus, inferior gemellus, and quadratus femoris to reach the back of the adductor magnus muscle. Posterior to the nerve lies another nerve called posterior cutaneous nerve of thigh and gluteus maximus muscle. This is the figure that shows the sciatic nerve, large nerve, arises from sacral plexus, and it rises from the pelvis by passing through lower part of a greater sciatic foramen, gemellus, inferior gemellus, obturator internus, quadratus femoris, and finally adductor magnus muscle. You can see an important nerve which related posterior to the sciatic nerve, which is the posterior cutaneous nerve of thigh. The nerve, sciatic nerve, leaves the buttock region by passing deep to the long head of biceps femoris muscle to enter the back of thigh. Sciatic nerve usually have no branches in the gluteal region. Second nerve in the gluteal region is posterior cutaneous nerve of thigh. It is a branch of sacral plexus, enters the gluteal region through lower part of the greater sciatic foramen below piriformis muscle, passes downward on the posterior surface of the sciatic nerve, and runs downward on the back of thigh beneath the deep fascia. In the popliteal fossa, it supplies the skin over the back of thigh. Branches of the posterior cutaneous nerve of thigh. First, gluteal branches to the skin over the lower medial quadrant of the buttock. Perineal branch to the skin of the back of scrotum or labia in the female. Cutaneous branches to the back of thigh and the upper part of the leg. Another nerve in the gluteal region is the superior gluteal nerve. It is a branch of sacral plexus. It leaves pelvis by passing through upper part of greater sciatic foramen above the piriformis muscle and runs forward between the medius muscle and minimus muscle, supplies both muscle, and it finally ends by supplying tensor fasciae lata muscle. The inferior gluteal nerve, another branch of sacral plexus. It leaves the pelvis through the lower part of a greater sciatic foramen below piriformis muscle. It supplies gluteus maximus muscle. Another nerve is nerve to quadratus femoris muscle. It's a branch of sacral plexus, leaves the pelvis through the lower part of a greater sciatic foramen and aimed by supplying quadratus femoris and inferior gemellus muscle. Pudendal nerve and nerve to obturator internus. These two nerves, they are branches of sacral plexus. The pudendal nerve and nerve to the obturator internus muscle leaves the pelvis by passing through lower part of a greater sciatic foramen below the piriformis muscle. They cross the ischial spine with internal pudendal artery, then immediately re-enter the pelvis through the lesser sciatic foramen. They then lies in the ischiorectal fossa. The pudendal nerve supplies structure in the perineum, whereas the nerve to obturator internus supplies the muscle, obturator internus muscle, on its pelvic surface. This figure you can see, this is the superior gluteal nerve, passes above the piriformis muscle, and here is the inferior gluteal nerve, passes below the piriformis muscle. Both of them, they get exit from the pelvis by passing through greater sciatic foramen. Also here you can see the pudendal nerve as it crosses above the ischial spine, passing from greater sciatic foramen and then re-enter the pelvis by passing through the lesser sciatic foramen to goes finally to the ischiorectal fossa. Arteries of the gluteal region. First, superior gluteal artery. This is a branch of internal iliac artery, and it enters the gluteal region through upper part of a greater sciatic foramen above the piriformis muscle. It then divides into branches distributed to the gluteal region. Second artery is the inferior gluteal artery, which is a branch of internal iliac artery and enters the gluteal region through the lower part of the greater sciatic foramen below the piriformis muscle, and then it divides into numerous branches that are distributed throughout gluteal region. In the gluteal region and area of the hip joint, there are an important anastomosis, two groups of anastomosis. They are responsible for supplying the area of the hip joint during its extreme movement. And these anastomosis, they are first trochanteric anastomosis. Trochanteric anastomosis, trochanteric refers to the greater trochanter of the femur. Trochanteric anastomosis provide the main blood supply to the head of the femur, and the nutrient arteries passes along the femoral neck below the capsule of the hip joint. Arteries which take part in this anastomosis are the following arteries. First, superior gluteal artery. Second, inferior gluteal artery. These two branches, they are branches from internal iliac artery. Third are medial femoral circumflex artery and the lateral femoral circumflex artery. And these two arteries, they are branches of profunda femoris artery, which itself is a branch of femoral artery, which is a continuation of external iliac artery. So this anastomosis actually between branches of internal iliac artery and branches of external iliac artery. And you can see this is the area of trochanteric anastomosis. This is the superior gluteal artery, this is the inferior gluteal artery, and here you can see the lateral femoral circumflex artery and the medial femoral circumflex arteries. And these group of anastomosis, they are represent the anastomosis between branches of external iliac and internal iliac artery. Second group of anastomosis, what is called cruciate anastomosis. They are situated at the level of the lesser trochanter of the femur. Together with the trochanteric anastomosis, provide connection between internal iliac and femoral artery, which is a continuation of external iliac artery. Cruciate anastomosis is formed by the following arteries: inferior gluteal artery, medial femoral circumflex artery, lateral femoral circumflex artery, and the face perforating artery, which is a branch of profunda femoris artery. And you can see this is the area of cruciate anastomosis. Lateral femoral circumflex, medial femoral circumflex, and first perforator artery. And you can see this is the area of cruciate anastomosis. This figure shows the origin of the sciatic nerve, which is a branch of the sacral plexus. You can see that the sciatic nerve originated from lumbar 1, lumbar 4, lumbar 5, S1, S2, S3. All these nerve roots, they give origin for sciatic nerve, which is a large nerve composed actually of two parts: a lateral part called common peroneal nerve and the medial part called tibial nerve. These two parts are contained or enclosed within one nerve sheath, and finally they will form a large nerve which is called sciatic nerve. Thank you.